Good evening guys. In this video we can see the most important high yielding psychiatric diseases and their durations and the psychotherapy or pharmacological therapy regarding that. Okay, first of all, schizophrenia. Schizophrenia is nothing but if a person having the clinical feature of increased delusion, increased hallucination, and there is an abnormal behavior for about 1 month according to ICD, 6 months according to DSM. It comes under schizophrenia. So the drug of choice is best in giving atypical antipsychotics. So the best psychotherapy is family intervention. Next is mania. Mania is nothing but a patient having the clinical features of increased interest, increased grandiosity, increased flight of ideas, increased activity, decreased sleepiness, and increased talkativeness. So all these will be coming under the symptoms of mania, and those symptoms should be present for about 1 week according to DSM and ICD. So the pharmacotherapy will be given for mania is anti-maniac drug like valproate. Lithium can also be given, but valproate we prefer. For the rapid control, you can give antipsychotics. Okay, the third is major depressive disorder. So it's nothing but the depression. So if there is any close one died, so the person will be suffering from a major depressive disorder. So just to say, for remembering the clinical features of a major depressive disorder, you can think of this scenario. So what will be the key features? The person will be suffering from increased guilt, increased sad moods. The person will have decreased energy, decreased appetite, decreased sleepiness, increased incidence of suicide, decreased concentration, etc. So these symptoms will be present for about 2 weeks according to DSM and ICD. These symptoms present for 2 weeks will be coming under major depressive disorder. Okay, so for major depressive disorder, the best pharmacological therapy will be SSRI. Okay, the best psychotherapy will be cognitive behavioral therapy. Yes, the next is delusional disorder. So in this, the key features will be only delusion. Okay, which will be presenting for about 1 month according to DSM, 3 months according to ICD. So what will be the drug of choice? The drug of choice will be antipsychotics. The best psychotherapy is insight oriented psychotherapy. We have to find the insight, or we have to give psychotherapy according to that. And the next is generalized anxiety disorder. Okay, so the future will be always anxiety will be there. The duration will be 6 months. So the best pharmacological therapy will be SSRI. The best form of psychotherapy of choice is cognitive behavioral therapy. Okay, cognitive behavior. cognitive behavioral therapy. Okay, we have seen 5: schizophrenia, mania, major depressive disorder, delusional disorder, and generalized anxiety disorder. Yes. Next, panic disorder. So the panic disorder is nothing but a person having the feeling of impending doom. So the presence of the symptom will be about 1 month besides this panic disorder. So the treatment will be SSRI here, and cognitive behavioral therapy for as a psychotherapy. The next is phobia. Phobia has always a stimulant. So after the stimulant, the person will have panic like symptoms. Okay, so this also have 1 month duration minimum. Treatment will be SSRI, but the psychotherapy is systemic desensitization, or it is also known as exposure therapy. Okay, yes, sorry for my handwriting. Next, OCD, obsessive compulsive disorder. So there will be the symptom of repetitive distressing incidents. So more compulsions to do that activity will be there. So the duration will be at least 1 hour per day. Okay, for about 2 weeks minimum. Okay, so here also SSRI will be the pharmacological therapy. The best therapy is exposure and prevention therapy. Sorry, exposure and response prevention therapy. Okay, next is post traumatic stress disorder, PTSD. So PTSD will have the symptoms of hyperarousal, intrusiveness, avoidance. So these will be present after the most dreadful events. So the symptoms will be occurring after or for 1 month duration will be coming under this category, and SSRI will be treatment for here. Here also CBT will be used. Trauma focused CBT will be used. In post traumatic stress disorder, history of traumatic incident will be there in the question, so see that. Okay, the last we can see about somatization. Somatization is nothing but a person having multiple symptoms. Somatoform pain is nothing but the person having the symptom of only pain. Hypochondriasis is nothing but a person coming to the doctor with the diagnosis of himself. He makes the diagnosis of himself. Okay, these symptoms will be present for the duration of about 6 months, each 6 months. So all these will have the same drug of choice, SSRI, and have same psychotherapy, CBT. Okay, enough for today. Yes. take a note on it. It will be very useful at the last time of your exam.